Good morning, ma'am. So, before anything else, before I proceeded to my patient room, I'll assemble and prepare all the necessary materials and articles that I'll be using for this specific care, which is perineal care. So now I'm preparing all the necessary materials that I'll be using for this procedure. So I have here the waterproof pad, the cotton balls, assuming that this is the forceps, and this is the irrigating solution, and this the premium pad, and then the basin with water, assuming. So now I'm done preparing all the necessary materials. I will now proceed to my patient room. So imagine that I already entered my patient room. First, I close the door, and if we're in a public hospital, I close the curtains. This is to provide privacy for them and for them to be cooperative and to be comfortable during the assessment. Good morning, ma'am. I'm Ethel, and for today, we'll be doing a perineal care wherein it involves cleansing external genitalia and the skin surrounding of it. The purpose of this po, ma'am, is to prevent infection and promote healing. So, for today's procedure, ma'am, I'll be exposing your perineal area, and we will be applying a waterproof pad underneath or above the bed in order for you to be not safe. So once the perineal area is exposed, we will clean it using an irrigating solution. Then after that, we will clean everything and put it back into normal. So now I'll prepare my patient. So before anything else, first I have to lower down this side rail, and then put this up this side rail. Then position my patient by cutting her back, and then provide privacy and avoid unnecessary exposure. So now I'm going to expose your area, ma'am. Can you flex your legs for me? Thank you. So I need you to turn on your side. Can you do it alone, or do you need me to help you? So I'm going to put this pad, waterproof pad. So after applying the waterproof pad, I have to position my patient in dorsal recumbent, wherein her back should be lying at lying position and her knee should be flexed and should be well apart, spread well apart. Go. Thank you, ma'am. So I'll be exposing the area where we would assess, like covering an area, and then I'll be covering the rest of her body. This is to this is for her privacy and for her to be comfortable since it is her private part. So now I'm going to wash my hands. Imagine that I haven't soaked it. So now I have to put my gloves on. This is to avoid spreading microorganism prevent and then prevent contamination. So now my patient is in a dorsal recumbent position wherein her knees is spread and well apart, and then her perineal is exposed. Then I have to
spread her lavia, and then I'll pour an irrigating solution. So now, after pouring an irrigating solution, I will now proceed on wiping the lavia which is using my forceps and the cotton balls. Then I'll going to wipe first the lavia minora, which is inside, and then I'm going to use the rules of sevens, where is the clitoris and downward. Discard the cotton balls and get a new one. And then on the other side, same manner, clitoris and downside. And discard the cotton balls. And now we will now proceed on wiping the labia majora. Same manner, should be clitoris and inside. Then discard the cotton balls and get a new one. Same with the other side. Clitoris and downward. And then so now we were going to dry it using a cotton balls, new cotton balls. So I have to spread the lavia again, and then we're now gonna wipe it. Gonna wipe it first. We should apply gentle friction while cleaning the perineum, and then we're now going to dry it thoroughly using a clean cotton ball. So I have to spread the lavia. I'm going to dry first the lavia minora in the same manner using the rule 7, is from clitoris and then one, and then discard it. And use another cotton ball to dry it on the other side. And then we're now going to dry the lavia majora using another cotton balls, a clean one, same manner with the first one. Discard it and use another new cotton. Do it again with the other side, and then discard it again and get a new cotton for the middle. Should dry it too roughly. So now after cleaning and drying the perineum of our client, we will now apply a perineal pad. And we will now put the client's panties on. So after placing our patient's underwear again, we're now going to cover her up using the blanket. Make sure that it's not wet. And then we're going to remove the pad. Can you turn to your side? Thank you. And then after getting this, we're now going to put this on a yellow bin. All the things that we use, we should discard it on a yellow bin, including our gloves. So assuming that this is the yellow bin. So after discarding all the materials that we use in a yellow bin, we will now proceed on hand washing. This is to protect it and prevent spreading diseases. So imagine that I'm washing my hands, and after that I will now proceed on documentation. So after assessing the patient after doing the procedure, we will now proceed on documentation wherein we document all the findings that we find. After documented on our chart, we're now going to evaluate the procedure on our patient. So, ma'am, ma'am, do you feel while doing the assessment, do you feel so as per the patients, she did not feel any discomfort or pain during the assessment.